Hypertension is really what we call a silent killer. It now affects, with the new guidelines, 42% of all Americans and over 1 billion people worldwide. The problem with hypertension is that we have several layers of treatment. One is lifestyle modification. That means losing weight, eating better, taking salt out of your diet for some people. Doesn't work very well, as people know. We have medications that are quite effective. Many classes of medications. Many people can be on 2, need 3, occasionally more medicines. The problem with medications, by and large, is compliance. More than 50% of people who are on 3 or more medications do not take their medications. Certainly don't take them reliably. They forget their medications. They forget to refill their medications. And so these are big challenges in the treatment of hypertension. So we end up with nearly half of all the people with hypertension either treated and not controlled, or in some cases not treated, in some cases not even aware. Because of the issues and the challenges in managing hypertension, many people have tried to devise a concept of using a device or devices or a treatment intervention to affect blood pressure, lower blood pressure. And this makes sense because patients don't want to take their pills. People either are not prescribed adequate pills or don't take them. What if we had a way to do perhaps a one-time treatment and lower someone's blood pressure 10 or 20 points? I will remind you that a blood pressure lowering of even 10 millimeters in the office is a 20 to 25% reduction in hard cardiovascular events. So that's important. Device-based therapy can do this potentially. The main ones that I think are still viable and in clinical trials, one is an intravascular intercarotid stenting structure, a device called the Mobius that stretches the carotid baroreceptors. That's in a randomized clinical trial right now in the United States for very high blood pressure patients. And then there are the treatments with renal denervation. There are 3 companies doing this. One is Medtronic, who everyone have heard of, with the spiral with radiofrequency ablation. And they're in major trials, both on medication, off medication. Another group, Recor, using ultrasound-based thermal ablation, and that is in randomized clinical trials. And then I'm affiliated, I will disclose, with a company called Ablative Solutions. We're the 3rd renal denervation company doing chemical renal denervation with microdoses of ethanol alcohol infused into the adventitia in the Target BP1 trial. That's a pivotal trial in the US that is just starting now.